Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This is the first episode of a 4-part series on acute myeloid leukemia, or AML. Today we're discussing how to address the barriers to care for patients with AML who do not receive a transplant. In many cases, difficulties accessing care are compounded by social determinants of health, which may ultimately impact treatment options. Our guest today explains why that is and how we can address it. Dr. Keri Maher is an assistant professor of medicine at the Virginia Commonwealth University Massey Cancer Center in Richmond, Virginia. Thank you for joining me, Dr. Maher. Let's get right into it. What impact do social determinants of health have on patients who are ineligible for transplant?
That's an excellent question. Social determinants of health are defined by the CDC, and there's been a lot of research into this exact area, both in the past and in the present. We know that patients that are ineligible for transplant may be so because of those social determinants in and of themselves. As you know, caregiver support is an absolute requirement for patients going on to transplant. So already, if patients are at a socioeconomically disadvantaged status, their family members may be too. They may not have caregiver support. They may not have transportation to and from the transplant center. They may not even be able to go to the transplant center themselves because of these issues, not to mention donor availability and so on that goes into racial disparities and other determinants of health.
Walk us through some of the common barriers that patients and especially underserved populations face.
There's 3 categories of barriers that patients face when accessing care. I like to think of them as patient-based barriers, institutional-based barriers, and social-based barriers. So when we're thinking about patient-based barriers, I think of things like what other comorbidities do they have? Have they had good primary care? Do they have good dental care? Do they have good mental health care? All of those sort of things that go into the comorbidity kind of scope of a patient. When I think about institutional-based barriers to care, I think about kind of the usual access to care-based issues, like how easy is it for this person to get to the cancer center? Do they have health care coverage? Do they have sufficient health care coverage? Those kind of issues. And then on the more social based barriers to care, I think about things like food scarcity, transportation issues, social support, family support, all of those sort of things, financial issues. Can these people take time off work? Do they have disability? All of those sort of issues. So there's a lot of them, but when I'm thinking of the issues that are barriers to access of care, I kind of think of them in those 3 domains.
What's the best way for care teams to approach shared decision-making?
When I'm thinking about shared decision-making in terms of treating a patient like a person and not like a patient, I like to start those conversations from the very, very beginning. You know, when you're meeting a doctor for the first time and you're hearing this cancer diagnosis, it's incredibly scary. But if you start those conversations right then you partner with the patient, you let the patient know that you see them as a human and that you want to see them as their whole self, not just a disease. And you can start asking them what their goals and preferences are right there. And it's important to keep those conversations going throughout the treatment history, because those goals and changes can change over time. You know, when you first meet a patient, they might say, treat me as intense as possible. I want a chance at a cure, which is a completely normal thing to say. You know, a year into therapy, the patient might say something like, I want to make it 6 more months because I want to go to my grandson's wedding. And that's a completely different goal. And you might manage that in a completely different way. And you would never know that if you didn't keep that dialogue open. You know, I've had other patients tell me that as long as I can eat chocolate ice cream, that's good enough quality of life for me. And so I like to bring these things back into the clinic when I see them the next time and say, hey, how did that go? How was that trip? How was that chocolate ice cream? Did you get to do what you wanted to do? Because at the end of the day, that's what we're here for, is to help the patients live the best life they can as defined by them.
How important is it to have multidisciplinary collaborative care for patients with AML?
I just think of AML as a team sport. That includes, of course, the academic center, the community center, the nurse navigator, the primary nurse, the infusion center on the medical end. But then it also involves all of the social support, the family members, the caregivers, all in one. So when we're thinking about AML, it's really a team sport of all those people working together to achieve the best outcome.
Thank you, Dr. Mayer. You can visit the show notes for resources and more information on optimizing care for patients with AML. Today's episode was made possible by funding through Bristol Myers Squibb. Make sure to keep an eye on this channel for the second episode in this series. And while you're waiting for that, you can check out all of the other episodes covering many topics in cancer care, both audio and video, on the Cancer Buzz channel. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.